With Ehlers-Danlos syndrome and my immunodeficiency, the smallest problem can be quite an ordeal. Honestly feel like this is the best pain management plan I have ever had.
Let's get a toe transplant.
I told her about my toe troubles.
Ah, yeah, freezing cold here.
So today is a busy day. I have 2 appointments, podiatry and then my pain management doctor. I'm going to a podiatrist because I have this ongoing annoying issue with my toes. So in early 2016, I had surgery on both big toes to fix ingrown toenails, and surgery sounds dramatic. They just numb the toe, make an incision, cut out the ingrown nail, and cauterize the end of the nail so it won't grow back. You're not supposed to have to do it again. But of course, with me, they came back. So when we moved here to Tampa Bay a few months later, I had to do the surgery on both toes again. Left toe is fine, but the right toe has not healed properly from the surgery due to my Ehlers-Danlos syndrome, and it is continuously getting infected. I know this is gross, sorry, but I've been on several doses of high course antibiotics. I've done wrapping it in antibiotic cream, letting it breathe, Epsom salt baths. I've done everything they've told me to do and more, and it's still giving me issues. So now my primary care sent me to a new podiatrist to see if he can hopefully help me with my pesky right toe. And with the kind of ingrown toenails I get, there's nothing you can do to prevent them, like cutting a certain way. It's literally like if this was my toenail, the side of my nail is just growing in. The only way to reach that is to make the incision, cut it out. And they cauterized it 2 times on each toe. Like, I shouldn't have to do it again, but it's life. So hopefully this new podiatrist can figure things out for me, because this will be the 3rd one I've seen. The other 2 haven't been able to help me. Out of all the specialists I see, I don't get nervous for any of them except podiatry. He looked at my toe and he's going to fix it for me. This doctor is amazing. He's so nice. I'm totally comfortable here now. And he just took an x-ray of my toe just to be safe and rule out no bone infection, and we've got a few other things in the works, So the x-ray looked great. I don't have a bone infection. We didn't expect me to have one, but the doctor was just being cautious. They also took a culture of the infection on my toe to get a better idea of what to treat it with. The doctor thinks I might have MRSA because it's been so resistant to antibiotics, and the only time it's resolved is when I was on IV antibiotics in the hospital, including IV vancomycin, which is often used to treat MRSA. But the problem is, even if I push the medicine through the J-port in my GJ feeding tube, I have malabsorption due to my Ehlers-Danlos syndrome. So the antibiotics in high doses still may not be working as well because of that. So the culture should give us a better idea of what's going on. And he also said he may need to go in and do a more extensive surgery on my toe, in which injecting with local lidocaine won't work, especially since my body metabolizes lidocaine very quickly. The reason I'm so terrified of podiatrists is because the 4 surgeries I had for the ingrown toenail with lidocaine alone, my body was like ripped through the lidocaine and it hurt a lot. I could feel everything. So he said if he has to do the more extensive surgery to correct what's going on in there from my toe not healing well, I'll have to go with IV sedation in the OR, but he's confident he'll be able to fix it. It's just like, with Ehlers-Danlos syndrome and my immunodeficiency, the smallest problem can be quite an ordeal, but I'm really happy with this doctor and we've got a plan to fix it. The culture should be back in about a week. And for the time being, he's given me a new prescription for an antibiotic cream to use on my toe, and I'll do the Epsom salt soaks and keep it clean and all that good stuff. Hi Hippo, you were so good at the foot doctor. Thank you. My mom helped me out today, but she's taking a rest before we go to my next doctor. And I'm going to rest as well, but I forgot to upload the vlog before we left this morning. It's not past noon yet though, so it's not late, but after that, take a quick nap. Got the vlog up, took a quick nap. I could have slept longer, but we gotta go. And before we leave, I'm gonna flush my feeding tube. Ta-da! And I am slowly increasing my rate today to hopefully hit that goal rate for day feeds, but I don't think I'll get to the goal rate for, I think it'll take at least a week maybe. On the way to my pain management doctor, we're going to talk about a more concrete approach to my pain, hopefully figure something out with the ketamine and joint injections. This doctor is pretty far away, and the long car ride is starting to aggravate my pain, but the travel is worth it for a compassionate and knowledgeable physician. After that long car ride, there was no way I'd be able to walk down all these hallways to get here, so I'm really thankful for my wheelchair. And Harlow's being good too. So hopefully gonna come up with a good plan. Really great appointment on the way. Oh my gosh, there's cows. Oh, I love cows. Anyway, we're on the way home. He was a really good doctor, right?
He was an excellent doctor. He had an answer for all your questions. He was very knowledgeable, very patient, and listen to what you have to say.
He's awesome. Definitely worth the drive, right?
We are Spectrum Enterprise, and we deliver the network and cloud services vital to your enterprise.
Oh, we're happy to be
Our
home.
experts work with you.
Wow, I am exhausted, worn out, and hurting from such a busy day, but it was really, really productive. And I had fun with my mom. I missed Judd though. He has today off, but we were both doing our own errands. So I'm going to update y'all on the pain management appointment and then get into my pajamas and go spend some time with my husband. One thing I wanted to tackle was a treatment plan for my really bad pain flares where the pain is just unbearable. So my pain management doctor prescribed a muscle relaxer he thinks will work better for me, and he's also giving me IV Toradol to put through my port and use as needed. I can only use the Toradol up to once a week, otherwise I could get kidney and bleeding issues, but just knowing that muscle relaxer and IV Toradol is there for when I really, really need it, that makes me feel a lot better. He also wrote me a script for hip braces to use after my hip sublux to help with stability after the subluxation, and he wants me to use knee braces when my knee pain gets pretty bad. I have sharp knee pains from time to time, and he said I might have something called patellofemoral syndrome. It's just a fancy way of saying that my kneecap doesn't really stay in place, and apparently that's pretty common with Ehlers-Danlos syndrome. I need imaging to confirm, but whether I do have that specific thing or not, the braces will help with the pain and stability when they're flaring. We talked about doing a nerve ablation on my neck for my neck pain, but for that procedure, I would have to be awake and coherent while the needles are in my neck, so we are certain he's burning the right spot. And honestly, I'm just not comfortable with that, and he respected that. So instead, we're going to focus on maximizing the ketamine infusions and the Toradol injections. So the ketamine lasts me about a month. We're really happy about that. For a whole month, I get no headaches or migraines. And then for about a week, it controls my joint pain. And for about 2 weeks, it controls my muscular pain. So it's not a perfect answer, but it does help with pain control. However, insurance will not cover ketamine infusions for pain alone. I can only get the ketamine covered if I'm getting it for anesthesia, because first and foremost, it's an anesthetic, but it does work with the central nervous system to kind of reset it and how it responds to pain. Since I have to be sedated anyways for my Toradol joint injections, that's when I'll be getting the ketamine as my form of anesthesia. Some people do joint injections while awake, but since my joints are so hypermobile from my EDS, my doctor feels it's safest if I'm sedated so there's no possibility of me moving. He also uses X-ray guidance for more accuracy, and if I get sedation, then I can have the additional pain relief from the ketamine. The soonest I could get in for this procedure based on the doctor's schedule and my schedule was December 5th, and from there I'll be getting it done every 4 weeks. The injections themselves only lasted me 3 weeks, but with the ketamine working as well, 4 weeks is a good interval. And on December 5th, we'll be doing injections in my right hip, then 4 weeks later my left hip, 4 weeks later my neck, and so on from there. The reason I'm not doing all of my joints at the same time is because you can only inject the same joint so often safely. Because ketamine works really well with my body hates propofol. I react very badly to it. I'm actually going to be requesting ketamine for other procedures I have done, like my last feeding tube exchange, I had ketamine as my anesthetic. I didn't get as much pain relief from that, and my pain management doctor explained why. When I had the tube change, they just used it to sedate me, but when my pain management doctor does it, his team makes sure that I hit a therapeutic dose of ketamine while I'm under. In between the ketamine injection procedures, I'll be getting a session of massage therapy because it helps, and all of that with the new muscle relaxer and IV Toradol to use for really bad flares, the braces, my trusty heating pad, and continuing my physical therapy exercises to strengthen the muscles around the joints. I think we've got a pretty good plan for my Ehlers-Danlos syndrome and chronic pain. Of course, this isn't a perfect answer. There's still going to be pain. There will still be flare-ups. I still can't do a lot of activity without bringing the pain on. And I have to be careful not to damage my hypermobile joints. But as a chronic pain warrior, I am thankful for any relief. And I honestly feel like this is the best pain management plan I have ever had. Chronic pain warriors, I share my story to let you know about the options that are out there and to let you know you're not alone in the fight for relief in the everyday battle we face with our chronic pain. But we're strong, we can hang in there, we can keep moving forward. If you want to learn more about my pain management protocols, I have a pain management playlist, which is pretty helpful. Where is he, Harlow? Where is he? Where'd he go? Go find him. Listen to what Janice told me.
Instead of getting, a body transplant, just get a toe transplant.
I told her about my toe troubles. It's really annoying.
Just cut off your toe.
No.
Well, it's the end of the night. We're tired and
Happy to be together after running our errands all day.
yes.
So, Harlan, come here. You gonna burp on me this time? We are going to relax and go to bed. So, good night, and thanks for joining us on our adventure.